Welcome back. Time for Ask the Expert this afternoon. If you need to lose weight, you may be wondering what gastric bypass surgery is all about.
So today we have Dr. Peter Garza with us as well, and his patient Peggy from Waukesha, who has gone through the surgery. First of all, Dr. Garza, let me ask you, kind of explain what gastric bypass surgery is, the procedure.
Sure. So the field bariatric surgery, there's multiple procedures that we offer. Bariatric surgery includes what we call the sleeve gastrectomy. That's one procedure. The bypass surgery is something that a lot of people have heard about, and then also adjustable gastric banding. There's different options for bariatric surgery.
How do you know that if you're a candidate for this? I mean, is there a certain weight you need to be, a certain amount overweight you need to be?
Right. We classify patients on their weight, something called a BMI, which takes into consideration patients' height as well as their weight. So most patients qualify when they hit a BMI of 40 or greater, or if there's a significant health concern, then patients with a BMI 35 or greater also.
And Peggy, during the break you were saying one of the reasons you decided to go with this surgery was because you had a knee replacement and you really weren't getting better. For anyone who's considering this, what advice do you have for someone?
It's a lot of work. This is not an easy fix. It took a long time for me to get healthy after the surgery, so I would say that you have to really get mentally ready for this.
You got to be committed.
It's not just physical, it's mental also. Yeah, I'm in the gym now 5 days a week and I love it. So I love my new body.
Yeah.
I'm sorry, is her results, are they common? I mean, is this what normally happens?
Yeah, the vast majority of patients have success, both with amount of weight loss, but then also resolution of medical problems. The vast majority of patients improve.
And for those who don't succeed, what do you think is, again, the reason that they don't?
We try to emphasize that these are tools. It's not just one thing that's going to help somebody. They really have to commit to the process. So there's a total commitment and lifestyle changes. That's where people get benefits.
I think the interesting thing he spoke about earlier was just kind of describing where your stomach was to where it is.
Size-wise.
Yes, size-wise. Explain that again, as far as a normal stomach compared to once going through bypass surgery.
Right. So the size of the stomach that you're able to utilize with both the banding procedure and the bypass is really only about the size of an egg. Wow. So about a quarter cup in size.
So you really do get full fast, as you mentioned.
Yes, you do.
Cheap date, as you said.
I am a cheap date.
Well, thank you for sharing your experience
welcome.
with us and us also learning more about the procedure, Dr. Garza.
Yeah, Doctor, thanks for being in. And if you have some questions for our experts, just email them at asktheexpert@tmj4.com. You can also leave a voicemail there. The number is 967-5253.